For millions of adults, knee pain isn't just a nuisance. It's a barrier to independence, vitality, and long-term health. Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. I am your host, Dr. Jeff Armstrong. I am joined by Dr. Tom Andriacchi, Emeritus Professor at Stanford University, and Jenny Erhart-Hledik, co-inventors of KneeMo, a groundbreaking wearable device developed from cutting-edge biomechanics research. KneeMo uses intelligent motion sensing and precisely timed vibration to reduce pain and improve muscle function, offering a promising alternative to drugs or surgery for those looking to stay active. We'll explore the science behind movement, pain modulation, and how this technology could help more people keep moving and keep aging well. Have you done any work with like athletes in return to play, maybe somebody with an ACL tear? Because I know I've worked with basketball players that have had kind of just inhibitions that their knee should be fine. They should be able to compete, but for whatever reasons, the nervous system is kind of preventing them from competing. Have you worked with any athletes in those regards?
We haven't, Tom, go ahead if you want, but we haven't yet. Our ACL individuals are farther from 6 months or longer from surgery. We actually have a new study coming out looking at 3 months post-op. Saw improvements there, but we don't have any specific case studies unless, Tom, there's one I'm not thinking.
Yeah, no, that's something that I think could benefit because one of the things that helps also is with rehab, that sometimes going to rehab and doing the exercises in rehab, pain will limit the capacity for people to do the rehab. We have now people that have had meniscus tear, and it was a tear of the medial collateral ligament, one of the major ligaments of the knee. And he was quite incapacitated and needed to go to rehab, but it hurt so much without using KneeMo that he couldn't do the types of things he needed to do. He put KneeMo on and the pain was reduced enough during rehab that he was able to quickly rehab the device. So we really want to look at that opportunity for athletes that can get back to activities and sports more quickly. The other thing it does is it helps restore the quadriceps function, which is a big issue in long-term conditions associated with knee pain. And even if you do rehab with the therapist, if you then go out and walk where you're not using your quadriceps, you still have the risk of not getting that quadriceps capacity back. KneeMo lets you get out and walk. The other thing we haven't mentioned is the idea that people with knee pain become more sedentary. And there are other conditions that happen when you're sedentary and not walking around. And cardiovascular health is dependent on being active. And, I just saw a recent paper, which I really, want to push a little bit more. And they say that the biggest mistake people make with knee osteoarthritis is they reduce their activity because they lose. What happens is the structures of the joint deteriorate as well. It doesn't help the joint to stay inactive. The ligaments, the cartilage in the joint need activity to be active. It's like an astronaut going into space. When they're not weight-bearing and not stressing those tissues, they degenerate. And for young people, that can come back, but for older people, that doesn't. The knee becomes less healthy and actually degenerates more rapidly to conditions where you need something like a total joint replacement. So one of the fringe benefits, and I don't think it's much of a fringe benefit, is it feels good to use KneeMo. People will use it when they go out and walk, and it will take that limitation of not being active and a sedentary lifestyle away. Also, mental health benefits from the idea that you can stay active with and do things you like to do. Like Jenny, she loves to jog, but she had to have something that took away the pain so she could enjoy the jogging. I play tennis, and the other thing with tennis is sometimes because of the adrenaline of the competition, I don't feel the pain in my knee or the stiffness till after I stop. And so it hurts sometimes and it's stiff when I walk around after I've stopped playing tennis. I use KneeMo for an hour to just go out and walk with it, and the stiffness is reduced because it keeps the joint moving and it removes some of that inflammatory response that takes place because of lack of movement and that activity, recovering from the activity.
So it sounds like the technology is going to play a pretty critical role in the future of aging and preventative health.
Yeah,
Yeah.
and I think that a lot of people, the thought process used to be that we needed to protect the joint, but the research is showing actually you need to stay active. But it's hard if you're in pain. Like it's difficult. So I think if we can provide something that can help people to actually continue to do activity, and like Tom said, for mental health, like there's a big loss that people feel, I think, when they can't do those activities that they really like because they're in too much pain. And there's a social aspect of that too. A lot of people, that's how they do social connection. So for us, that's an exciting thing to help people have that quality of life, have that better quality of life potentially, by reducing pain, but by letting them do those activities. So for me, that's the rewarding part of it.
I always teach my exercise science students that, the solutions that we're after are always biomechanical, psychosocial. And we tend to forget the mechanical piece and all that. You hear a lot of physicians say biopsychosocial. But do you have any really interesting feedback stories or stories of success stories of people who have used a device for some period of time? Some most inspirational ones.
Yeah, and like one individual who reached out in particular, he had struggled with knee arthritis for quite a while, tried multiple braces, tried the medication route, tried all different things. Was finding he was someone who had played like badminton for a really long time and had to stop, and had mentioned like it gets depressing, right? You're not doing that thing that you always liked. So he found out about KneeMo and tried it. It's cool at first, right? You don't know a new technology. But he said once he put it on, he realized like he was able to go walk 10,000 steps, which was really huge at that point for him, right? And now he's up to 15,000 and back to playing badminton a couple of times a week. So things like that is really great to hear for us. And then another individual who is a younger person who had knee injuries, again, has tried all different things and just hadn't found something that worked really well for her. And she found out about KneeMo, has been trying it, and now she's jogging with it and hiking with it. It's a really active person who was missing that ability to do that. And then, like Tom mentioned, some people who have had total knee replacements that are struggling with pain, and it's like, you've already had the surgery, like why isn't it fixed? And now they're using KneeMo to help them so they can still do activity, even if they had the surgery that wasn't the perfect outcome that they were hoping for.
Now, this might be an early question to ask, but do you see any other future joint applications for the technology?
Yes.
Asked that a lot, and yes. Tom, you can talk about that. Back, we think, is going to be next.
Because the same platform with the motion activated vibration stimulus. Yeah, I've already built the prototype for the back. And one of the other conditions I get after tennis is a backache, and it helps. And the steps there are interesting because the back pain is also sensitive to the abdominal muscles. And one of the things, because they compress and increase or they reduce the compression on the spine when they contract. And so what we're trying to do is perhaps a device that senses the motion of the abdominal muscles related to the pain on the back. But again, we want to keep it simple. That's a key. The other area that it's funny how selfish this is, because I have shoulder problems when I play tennis too, and so I've tried it for the shoulder. And it seems I had a friend who had rotator cuff. He couldn't lift his arm above his head. I just put a mock-up of KneeMo on his shoulder, and almost after 2 reps, he was able to lift his arm above his head. So we're targeting the shoulder. Obviously, tennis elbow is another place we want to apply this, because the platform of the mechanical stimulus that vibration introduces onto the same nerves or the same nerve pathway that transmits pain is effective. And so we want to really take advantage of that. I think the group in Israel is working on the ankle too. We have one of our advisors started in my lab at Stanford on the project and is now at the Technion University in Israel and has been applying it to other areas of the joints. Yeah, that platform has a lot of potential for mitigating pain and enhancing movement and the benefits of movement that you get.
Well, if you ever need anybody to test out a back or the shoulder prototype, I'm here. Because that's one of my big issues. Yeah. I mean, I wake up with back stiffness every morning. I mean, it doesn't impair me. I'm able to push kind of through it, and I lift weights and do all that kind of stuff, and it's not an issue. The shoulder, limits me a little bit because, just the pain. But I know from experience that the vibration would really help because it's going to get kind of past that inhibitory piece that prevents you from doing the movements. So this is fascinating technology, and you got a believer right here. So
that's good to hear.
So, I mean, sometimes you see this technology that's put out there and you're like, I don't know. That just doesn't really make good physiological sense. I think they're selling snake oil. But this is something that makes physiological sense. I think it can benefit a tremendous number of people. And I think you've only scratched the surface of what the technology can do. And processors are only going to get faster. So it's going to make it a lot easier to be able to apply much of this technology. So in the health landscape, which is often dominated by surgery, medications, and those types of treatments, how do you see non-invasive solutions like this one really changing the game?
I think there's a growing trend of people who want to hold off, right, on those invasive options, and they're looking for something that either prolongs how long they can wait to do that, or, like I said, KneeMo can be used in conjunction if you are having some of this, you're still not getting the exact relief that you need. You can do both, and the nice thing about it is you're not taking a pharmaceutical. You're not doing something else that potentially is causing damage. It's something to try and see if it can give you extra relief. And I think there's going to continue to be this trend. And it seems like that's the way the landscape is going. We're trying to give options that are non-pharmaceutical, that aren't necessarily immediately going straight to a surgery, which I think, there's people who are getting injuries younger and younger, and we don't want them to necessarily have to go get a total joint when I know some people who have gotten total hips in their 30s, right? That's young to be getting a total hip replacement. So same thing for the knee. If you can wait and prolong that, and I think people want to, that they're going to try and do that as much as they can. And if we can give them new options to try, I think it's good for people to have different options to see what works best for them.
All right. So I asked this question of all of my guests, so you can't escape it, and you can take it one at a time here. What are you doing personally to age well?
Well, I'll start because I'm aging.
We're all aging.
Yeah. So I'm 78 years old. I still play tennis. I still keep my mind working on these algorithms to make new devices. I also collect classic cars and redo them, which has been fun. And I play with my daughter's 4 Malinois and a German Shepherd. So,
So what's your favorite classic car?
Oh, the '59 Corvette.
Good choice.
I have one, and we take it to shows, and it wins trophies all the time. So.
All right, Jenny, how about you?
Yeah, for me, staying active, physical activity for me is like a non-negotiable. So every single day I have to do something, and for me it's running or boxing. Actually, I love boxing, and I think the reason I like it so much is because you have to think while you're doing it. You have to actually be engaged, and your brain has to be working. So for me, it's those two. And I like traveling a lot. So our family tries to explore new places all the time. And so for me, like just exploring the world is something I want to keep doing, and seeing new cultures and learning about different places.
So how did you get into boxing? I mean, I understand the running. You look like a runner. Were you a college runner or any of that?
Not a college runner, no, just for fun. I was a pacer for several years for marathon training. I did that to make some money as a grad student. But no, I was a dancer growing up, and I think a lot of like that same like thinking of combos and thinking of things like that, it translated into when I couldn't run for a bit, trying boxing classes, and then I fell in love with them. So now I do that every week too.
So I learned something here. I didn't know Jenny was into boxing. I'll have to be careful when we're debating things now.
Yeah, just keep outside of her reach.
Yeah, right.
All right, well, is there anything we've missed talking about that you wanted to address in kind of the technology and the product?
I think so. I think the only other thing is if you want to learn like more about the science, we have a website, so you can check it out. It's theneemo.com, and it's KNEEMO, not like the Disney fish, but so like the KneeMo. And there's more about like our clinical trials on there and the science of how it actually works if you want to do a deeper dive and read it, and also like hear about people who have used it and testimonials and see those as well.
And we'll include links to all that in the description notes. But if there's one thing that you want our listeners and viewers to understand differently about pain, movement, and aging well, after hearing your story, what would that be?
Stay active. Find a way. A lot of the treatments don't necessarily address staying active. You can take a pill and sleep on the couch, and maybe the pain feels better, but your body is going downhill when that happens. And that's what KneeMo does. We call it pain relief in motion, because it encourages movement to continue, and by reducing the pain. And so I would say that's the key message that I would suggest.
Yeah, I agree totally. And I think it's find something that works well for you. Find what makes you happy and what you can do that stay active, whether it's hiking or if it's cycling. Like find the thing that you actually are going to enjoy doing, and then find a way to make time for that and do it, because it's really not just your joint health but your whole health. It's going to benefit. And eventually you'll have a full body KneeMo suit that you can wear. Yeah. It'll allow you to play pickleball, do whatever you want.
One of our active influencers is a pickleball player, because that's a sport that people take up maybe later in life, where they may not have been super athletes younger in life, and there's a lot of injuries that take place. And I just talked to another pickleball player this weekend, and they said, boy, we've got people that fall down on their knees and twist their knees. And so I think one of the things that happens is injuries take place when people switch to an activity that they haven't done before. In other words, they may have run short distance or take long walks, and all of a sudden they're going to do a marathon. You can bet they're going to get an overuse injury without the proper training to work themselves in. Because what happens, the tissues will slowly adapt to a new activity. They won't quickly adapt, but they'll slowly adapt. And if you train up to the kind of level you want to do in a sport, it will help to not get an overuse or even worse type of injury. So again, stay active. Use KneeMo to take the pain away, and you'll be happy.
Yeah, I teach my students that overuse problems are really just a problem of poor coaching or poor implementation of an exercise program. That the biggest issue for most Americans is not overuse, it's underuse. And it seems like KneeMo is a perfect tool to be able to get us active again. And we know that I think it's like 2/3 of the American population are not even hitting the minimum guidelines for physical activity. And part of that is probably due to pain. And so if we can alleviate that and get more people moving, we're going to have a healthier America. So I really appreciate all that you're doing. I look forward to future developments. So we'll have to have you back on when you get the back brace done and all the the studies are done on that. And until then, just keep doing what you're doing and keep aging well.
Wow.
Thank you for having us.
Thank you. Thanks.
You're welcome. Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.